the big testing would be aligned with what NAM has already created.
Can we get reimbursements from insurance panels? And that completely depends on the insurance panel. If we did go for licensure and we received licensure, if the insurance panel accepted us, then you could choose to become a provider for them or not. And there would be two ways that we would be looking at this as practitioners. One is, does it provide additional source of income so that our practice is sustainable and we can actually make a living doing it? That's a question mark. The other is, if we offer insurance, does it actually open Ayurveda up to a much wider pool of healthcare seekers looking to, looking for help, and they may not be able to afford it without being able to accept insurance. So those are the two reasons you would consider insurance.
This is sort of a broad question, but what is the worst that could happen? You continue to practice under Health Freedom Act, which means that anyone can practice Ayurveda. Membership in professional associations like Kalarama and NAMA are voluntary, and Colorado does not require minimum education or experience requirements to practice Ayurveda. So essentially, it's status quo.
Even if DORA accepts our Sunrise application, we may have to lobby the legislature to get our rules passed. It is a very political process. Do we know who are the lobbyists for the naturopaths, the acupuncturists, and the chiropractors? Leo Boyle represents the Acupuncture Association of Colorado, which oversees acupuncture alongside the Colorado Office of Acupuncture Licensure and the NCCAOM, National Certification Commission for Acupuncture and Oriental Medicine. He also represents the Colorado Chiropractic Association and the Colorado Midwives Association. Our lobbyists for the AAC include Anne McGeehan, and the Tilden Strategy Group for the CCA include Mary Alice Mandarich, Eric Groves, and Integrated Legislative Solutions. Annie McGeehan and Crystal McDonough also represent the Colorado Association of Naturopathic Doctors. Lobbyist info can be accessed from the Secretary of State website at www.sos.state.co.us/lobby/principalresorts.do. If you want that information later, I'll be happy to give that to you.
Self-regulation is ideal. How do we assure that our licensure board will actually be populated by people who know what Ayurveda practice entails? We plan to propose the establishment of an Ayurvedic review board comprised of 4 professional Ayurvedic practitioners, AD/AP/AHC, and 3 lay members. If we adopt NAMA's scopes of practice and certification exams as a requirement for state licensure, we can be certain that they are all operating under agreed upon scopes of practice and minimum education and experience requirements. Regardless of the outcome of the Sunrise process, we may want to institute an Ayurvedic review board in Colorado and require our members to include contact information on client-patient intake and disclosure forms to demonstrate our understanding of the self-regulation process.
Do we have a supporter database?
In support to that self-regulation, all of you already know that Colorado now is offering the legal package for Ayurvedic practitioners that was developed with the help of Bob, which we have now to offer at a very discounted rate, and it's already on the website. This really will help with regulating ourselves and protecting us and our clients.
My comment real quick on that. What we did was to take a disclosure statement and someone from the various professions, and I had my staff handcraft a set of documents for you, and we discounted that way down. And what we did was, and then part of that goes back to the Colorama organization, because we donate part of that back. But it's a good packet for you, and it has a disclosure statement. We threw in a HIPAA act, or a HIPAA policy, because nobody really knows what HIPAA does. And I got a call from the HIPAA people, and they're confused on it. So what we did was, because so you have a good packet that is available to you that you ought to take a look at. And then for any customization that you need, or any special concerns you have with your practices, contact us so we can customize it for you. But the whole idea was to I got in trouble with my office manager because I said this is what we're going to charge, and it's way below what we typically do. But I wanted you to have something good, because so that's available to your board. So check that out, because that is worth having for you.
So while we may be under an eclipse now, the stars and the planets were very much aligned when we found Bob. His generosity to our organization has been astounding. If you read my letter, which I blather on and on and on when I'm writing those things, because I can be very verbose, but I did initial research about when I first started Roots of Wellness Ayurveda, and contacted a number of healthcare legal teams, and I was being quoted $2,500 to $3,000 to put that package of paperwork together for my new fledgling practice. Bob is offering that for $450, and he is donating back over 20% back to Colorama. So please take advantage of that legal package, if you're a member.
My office manager gets mad at me every other day for that.
Oh boy.
I hear that from her. So please take advantage of it, because it's something that is good for you, and it will protect you. It also lends a level of professionalism to you. I think you'll show.
Does it include liability? Is that all enveloped in it?
We've got the whole list of documents, which documents are included, which forms are included, and that's all online.
Okay.
Yeah.
All right, and our last question is, do we have a supporter database and patient clients willing to come forward to support our rulemaking before the legislature? The answer is not yet. However, Tara Fael, who's been working with us, has suggested that we consider sharing the names of our best patients and clients and form a database through Colorama. This is how the direct entry midwives lobbied to regulate their practice in the early 90s. We may call on our supporters to meet with, write to key legislators at different times in the process. And we can also reach out to other supporters, including supportive MDs and licensed CAM practitioners.
So that's all we have from our end, and now we're going to open the floor up for any questions from you all, and either we or Bob is here to help us clarify any of the questions you have.
I can probably say it loud enough.
When is decision day?
We have 6 months to really get something in the door. And that's our time frame is 6 months for the recording. That's our time frame to get something going with them. So we need to kind of have, you can opt for different things here. You can opt for registration. You can opt for all kinds of things. You don't have to go all the way for licensure. The point that I do want to make is you've got a hardworking board here. They've not asked me to say this, but they can't do this by themselves. This is going to require your help, and it's going to require a lot of time. Licensure may be a lot to bite off here, but at the same time, would be a great day if we got it. So we have about 6 months to get a proposal into DORA. And the sooner the better, because we need to start meeting with them and saying this is a good thing.
Heather, I know you said some of this information, or all of this information is on the website, but I was wondering if Bob or you, Heather, could touch a little bit more on this packet and what it would do for me specifically as a practitioner or as a small business owner in that sense. And what am I getting from this?
As a licensed psychotherapist, I have a package, and I do not even see the client without receiving all the information in the package. And that they sign and they give their consent for everything that I do in the package. And when we were working to develop this package, especially for Ayurvedic practitioners, we had to work on what our scope of practice is, what we can and we cannot do, and everything is spelled out in all of those forms.
So this is really something that you put together that you're providing the client?
Yeah.
Yes,
Okay.
it is for it is a disclosure, yeah.
So here, I can give it, yeah. So we've got the disclosure forms, your client disclosure forms. So it says, it says everything that the client needs to know about the legal practice of Ayurveda in the state of Colorado and what they can and can't expect. It also has a credit card authorization form, which any of you small business owners know how difficult it can be to track down the client that walked out the door and is supposed to pay you. So in advance, you actually can get that credit card authorization form. It spells out how you bill, when you bill, and they will agree to it or not agree to it, but it's all spelled out up front, so that takes that pressure right off the table, and you just don't even have to worry about that. It also has a business associate form, so if you are working in partnership with another practitioner or you are looking to form a cooperative of some sort, all of that is in there and it's spelled out up front and it can be customized. Let's see, what else was it? Oh, the HIPAA form just basically, covers us and says we are caretakers of your private information and we understand HIPAA and here's what you need to understand about how we use the information that we gather from you. So it's everything, and there's a number of other forms, but it's everything that you need in order to engage in that practice. And these are forms that are very familiar to our healthcare clients and patients. They fill it out at every other doctor's office, so you can attach that with the initial confirmation. They can print it off and bring it, or you can have them there and they can sign them there. But it's all included, everything is included.
Does that accommodate if you're an Ayurveda practitioner / yoga teacher?
You can customize those forms
You were talking
about whatever your practice, for your scope of practice.
Okay.
And there's also a release of information if you would want to include other family members, or a release of information to the doctors, which doctor or which other healthcare coordinators that you would like to communicate with. So the consent is very important.
Is there an additional fee to customize?
It depends upon how extensive it is, and it depends on what you want to do. The rule is if you disclose something, you can do it. That's the general rule. So if you disclose what your practice is, that you are incorporating yoga, for example, or whatever, then you're free to do it. You have to realize we're creating stuff that our regular forms have been 10 to 15 years in the process. DORA has not challenged one of our forms. They've actually borrowed from our forms on the official DORA website. I told them that they could do that. HIPAA, in turn, also did the same thing through OBH and other things. Because I'm a former government lawyer, so they called me up and they said, this is, can we use this? And I said, well, sure, kind of thing. There would be a customization fee, but I've instructed my staff that to really help, to help you out. The way the law firms work is you have to get it in the law firm database because we have disclosures we have to give to you. You have to become a law firm client, and then I typically don't charge for simple questions or things that You're not gonna get nickel and dimed. This is something that we try to standardize all we can in that sense.
So it seems like we have a lot of support for people with the board, and we have a gem and a gift from Bob. And in my opinion, when you see opportunities, go for it. So I hear it's going to cost a lot of money, and you need support from the community. What kind of support? How would we get the money? And like what would it take, and why would we really not just go for it? Because it seems, and how do we decide? How do you want us to let you know?
My perspective, I think as members, you all elect us, and we are bringing everything to you in the form of educating you. And so I'm going to hand this question to Heather and Bob.
Anyone else? All right, just checking. Yeah. So yes, opportunity, and thank you. That is support. Right there, that's support. How can you support us as members of Colorama? Join one of our committees. Please join one of our committees. Work with Sujata, with governance, because if we do tackle this application, it is going to take a tremendous amount of manpower. And I can share with you that I'm already putting in a tremendous amount of time into this. This is like a second job for me. Just kind of shepherding this along and making sure we're getting questions answered. So join the governance committee with Sujata, join membership with Sebastian, and start making phone calls to our other members who didn't show up today. We're a very small portion of our membership body here. Encourage your associates, your network, your friends to join Colorama. Encourage your not even your Ayurvedic network, but your yoga network, your Jyotish friends, your, all the different sciences. Encourage them to join as supporter members, unless they want to actually have advertised through Colorama to get their professional bio online through our website. Then they would join as a professional member. But even as a supporter member, those are all ways. We do have a healthy budget, and we've got a healthy amount of money that we have saved up, considering we are the micro organization, grassroots organization that we are. So we already have a significant portion of money that we could designate towards this $10,000. There's going to be additional fundraising that would need to happen there. Your donations are always accepted. We need to have lots of conversations about those next steps. So this really was us providing the information that we have to this point. We're open to your ideas, we're open to your feedback, and how we're going to make this decision is we're going to hear from you. We're going to hear from you whether we want to go for this or not, and then we will discuss it as the leadership. And we'll make that decision. Going back to Mary's question, we don't have a date for that decision. It's an ongoing process. Okay, all right. Did I answer all your questions? Was there anything else that I left out?
In that round, yes.
Yeah, okay.
That was actually going to be one of my questions, is what is our membership actually? How many members do we actually have?
It fluctuates, but we're around 30, we go between 30 and 40 active members. It's gone up to 70 in the years that Dr. Lab was here. So it's always interesting to me that we have all these people join and then they disappear. And so one of the constant conversations that we're having is how do we outreach to the members who have dropped off and are, I don't know, out in their various corners of the universe doing what they do. We're always looking for new ways of engaging our potential membership. And we've also coordinated closely with NAMA so that when a new Colorado practitioner, when someone moves to Colorado and is with NAMA, or someone new, signs up with NAMA, they are directed to us as the state organization. Also check out Colorado. So there's different ways that we're trying to bring in.
And my other question is, there was mentioned by a couple of you, I think, that we expect our main opposition to be from the AMA and the APA, I believe. Okay, I was wondering whether do you expect no opposition at all from, say, for example, the pharmaceutical industry? I've been reading things about how they're trying to gain control over CBD oil and things like this. But
Bob, do you want to answer that?
Yeah, what about the naturopaths? They don't like competition either.
I haven't heard from the pharmacists. I've got a bunch of pharmacist clients that I can run this by. I don't really see. What pharmacists sell are a lot of supplements and are a lot of things. I think that you would be an endorsement to them in that sense. The heavy hitters you want to contact, of course, are going to be Walgreens. They're going to be one of them, Walmart, for example, CVS, that kind of thing. You're going to want to hit those. The pharmacy market is coming down to 4 or 5 that are really going to rule the roost. That's what's going to happen to us. Is that we're going to be subject to those 4 or 5. Yes.
I actually was referring to the pharmaceutical industry trying to take control over herbology, rather than the sellers of.
It's pretty diverse for the pharmaceutical. The question was, will the pharmaceutical industry take control over the herbology? And the field is so diverse and so big for them to gain control over that is going to be quite hard for them to do.
Thank you, I'm glad to hear that.
What about naturopaths? That was what Tara brought up. Do we fear repercussions or pushback from naturopaths?
No, I think we could come into an line. No, I'd like to. Other question is naturopaths. Excuse me, would they oppose us? I'd rather come into a line with them, and possibly again, nurse practitioners are calling us right and left. They're the ones to get on board with if we can, because they like you. I mean, this is something that they agree. They see the value of it a lot.
How do we align with the nurses? What are the steps to do that?
How do we align with the nurses? We make contact with the professional associations. Professional associations really rule the roost here, which is why Colorado has got to be as strong as it possibly can be. I can't say that enough. You've got to be in the forefront. If you're not in the forefront and strong, you're a small voice. You've got to be in the forefront here, and it's got to be done. This is critical stuff. But the professional associations speak for them and so on. We'll have no opposition from groups like the social workers. We'll have none from them. It's going to be the medical field, and you kind of have the planets are aligning in a certain way here, because the AMA, the poor, is getting beat up. I mean, their physicians really are. And this may be something that we can really capitalize on.
As you can see, Bob has been as successful in his practice as he's been over the last 4 decades, because he really goes to a collaborative model. It's how do we align, how do we work together, how do we support one another, and when we even approach the AMA, it's going to be, here's how we can support you. Here's how we can take a load off. And never before, I would say, in the history of the AMA has this even been possible. Now, are there still going to be strong, stalwarts who are not interested at all? Of course, there are. Are there a lot of young doctors who see the value? Yeah, there probably are. So we don't know yet. We just don't know. But Bob's way of approaching it is always, how do we work together? And how do we do this in a way that we're not going to take away from you, but we're actually going to complement you?
Beautiful. Thank you.
Yeah, one example would be Kaiser, in looking at their practice. They have acupuncturists in their model of practice. Do you want to say more about that?
Kaiser has changed a whole lot in the last several years. I have a Kaiser policy for my staff because what is, I don't use it, other they do. They have found the Kaiser to be very, very user-friendly for them, and has really allowed them to seek alternative measures, all kinds of things. And so and when Kaiser doesn't have the answer, they have no hesitation to refer out to a complementary practice or anything of the sort. That's a major, major change. And Kaiser, don't forget, worked very closely with the healthcare reform bill, which is still very, very strong. Kaiser was right in the middle of that. And the Obama administration conferred with Kaiser, and Kaiser back and forth to really get that bill passed.
Anybody else?
So if we seek licensure, and my guess is we have our scope in Ayurveda that we practice, how hard would it be to add scope, like the scopes of practice to a licensure? For example, if we want, we want to be able to order medical tests, or if we want to start Ayurvedic needling or something like that. How hard is it to add scopes of practice?
Bob, do you want to answer that?
Sure. That's kind of the question of the decade here, because scopes of practice, we're going to be, the safest answer is to say that we're going to refer out. We're going to collaborate with the physicians and so on, and then you're going to be in active collaboration with them. You're going to be far more patient interactive than you have been before. In that sense, you're going to be working directly with the patient and the physician and say, this is a test we got to take a look at. That kind of thing. That would be the approach I would take to it. So, but I can't tell you what the scope is yet, what it's going to be.
Do you have to kind of wait a certain period of time to
Yeah, the sunset. That's what the sunset.
Right.
I think we have to just take it
So if you wanted to add
Yeah.
things, then we have to
Yeah.
do it at another point.
We may have to see how the whole thing flushes out. How really, the question is, do we have to wait a period of time? And we may have to see how the first process goes. This initial sunset, now Dora wants it to go a long time, so they don't have to do much. They want it to go a full 7 to 9 years. They may get stuck with 5 years. And if so, during that 5-year process, different issues come to a head and that kind of thing. But you have to remember, Dora came from a position several months ago saying, we have no recommendations to the sunset process. We have none. We're not going to change anything. That's where Dora was. So we're expanding that on them in that sense. So I can't tell you where the scope of practice. We're going to have to create national standards, statewide standards, and really follow those and see where that leads us.
I just wanted to add something to that question about scopes. The scopes that are being worked on by NAMA they're pretty broad or pretty general, so it's not spelling out you can do X, this, and this. It's just basically saying you can treat people Ayurvedically. It's limiting the scope for the Ayurvedic health counselor. We're working on what the difference between the scope of the doctor and the practitioner is, but there's not really more you can do. It's just like kind of spelling out what distinguishes a doctor. But as I understand, when you're doing legal stuff, the more broad and general you are, then it means you haven't cut stuff out. So that's the approach that's being taken. We're actively working on like finessing the scopes, the national scopes right now.
And just one encouragement, I know we were talking, or Heather, you were mentioning that, trying to grow in strength and get a stronger board. And I guess from an encouragement remark, we have some brilliant minds in this room and some that aren't present, and this is a very ripe and plum moment to, if we want to take this step forward, even though we may not have the strength in numbers yet, we've got strength in good minds and good persons really representing us. So that's the first thing. And the second thing is really opening ourselves up to maybe some unique measures. So I met a musician who wanted to produce her own CD, and the music industry right now is in flux, and so you can't find people to sponsor you necessarily more to produce a CD, so you go out and you basically do fundraising. And so she was able to raise $20,000 in a matter of just a couple of months in order to go ahead and get her CD produced. And those are going to be maybe the kinds of things that, in order to shore up our strength, we're going to maybe consider those types of options.
And maybe we have to set up a fundraising committee separately for this same cause and see what ideas our members have and who wants to be in that committee and what they can do to help the whole process.
I had a comment. The intention, I think, of today was to be informational and to open up the conversation and the discussion, but also to get you guys excited. If you have any interest in this and you feel like it's important, we really, for the bulk of manpower is what you see sitting up here. Madison has, I think, a robust committee of 3, but we really, if this is important to you and this speaks to you and you see value in this, we really need you guys. You showed up today. We would love for you to show up in other ways to support Colorado, because we really need a community to make this happen. We could feasibly do it with 3 or 4 people. I think the midwives did it, or the acupuncturists have done to sort of accomplish this. But a strike team. But really, for this to be a healthy effort and successful, I would really encourage you guys, if you have any interest, even if you have a couple hours a month, just say, hey, I'm interested in supporting and helping, because we might have 30 active members, those are paid members, but we really have maybe